Hi, everyone. I am Katie Brumfield. I am the Career Services Specialist at the Colorado School of Public Health. And today I'm talking with Nicole Harty. Nicole graduated from our school with her MPH in Community Behavioral Health in 2016. Hi, Nicole.
Hi.
How are you today?
I'm doing all right. It's good to have the opportunity to tell people a little bit about what I've done.
Great. Why don't we start off with you telling us what your current job title is and where you work?
Sure. So I am the epidemiologist data manager for Routt County Public Health. So I am here in Steamboat Springs.
Oh, did you get a lot of snow today?
Not so much today. We're hoping
okay.
for more overnight.
Oh, okay. Okay, so Routt County, how did you get this job there and how long have you been there?
So I took this position, I started in September of 2020. It was a new position. The public health department had sort of been forming over the last year and a half or so. Time's weird. I don't really know at this point. And they needed to stand up their team, and particularly because of the pandemic, they needed data support and they needed epidemiology support to do all of the case investigation and all of that work. So that's how I came on.
Wow. Could you tell us, maybe like a day-to-day or big projects, but what does your job entail?
Yeah, so every day, every week, things change. In the pandemic, I think everyone is aware of that. And that's true for public health too. So generally speaking, I work with our contact tracers and case investigators to make sure that we're following up on all of the cases that we're notified of. I work in close partnership with all of our providers in the community, all of our schools, key partners, the ski area, to make sure that everyone has all the information that they need. I help issue quarantines for larger cohorts if necessary, provide guidance and support, manage all of our data. So I built our dashboard from scratch. We rebuilt it after I started. So I'm responsible for maintaining all of that. So a little bit of everything. Talk to the community, live stream on Facebook, and really just try to get a handle on the information that we have in the county to make good policy decisions for our community.
Wow. So when you jumped into this role during the pandemic, you had to go full speed.
Yes. Honestly, I didn't know what I was signing up for. I'm really glad that I did.
Yeah.
But I had no idea what I was getting into.
And public health, things change, right? And
this won't be what it looks like forever. And that's what I'm really, really excited about. This is such a great opportunity to learn so many things really quickly and be exposed to some of the best parts of public health, of all of the community partners and all of that. And that's just going to be so incredible when things slow down and we're not just doing COVID all the time.
Yeah. Is Routt County, is it very small, the county?
We have 25,652 people.
And how many people work for the health department?
We have 3 permanent full-time staff. We have our director, myself, and a public health nurse. Because of the pandemic, we have a team of contact tracers and case investigators and contracted nurses. We also have a medical director who is part of the team and will be permanently, but is not full-time for us.
Okay, so it's a pretty decent team. Yeah. So your concentration was in community behavioral health, but it sounds like you're doing a lot of data work.
Yeah. I came from a more data background. My undergrad degree is in neuroscience, and I was interested in public health when I was in undergrad. Didn't really know exactly how I wanted to go about that. Took a few years off, and when I got my master's, I was really more focused on some of the skills and the areas that I didn't have as much experience and exposure to around program planning and community engagement. The data side is something that comes pretty naturally to me. So I felt like my coursework could really supplement the things that I had already had some experience in.
That makes a lot of sense. And that's a really good way to pick a concentration is, looking at the areas that you don't have as much experience in. Because it does package nicely on a resume.
Yeah, I didn't really know that was how it was all going to come together when I was doing it. I just sort of had an inkling, like this is how I should go about it, and it worked out really well for me.
Yeah. How did you get into public health? Like, what sparked your interest in a career in public health?
My first experience, I was part of Global Brigades when I was an undergrad. It's a student-run nonprofit that primarily does work in Central America.
Oh, cool.
And I went on a medical brigade and then a public health brigade. And that was really how I got exposed and really started to think about how the medical field is so much more than just the clinical medical roles.
Yeah, I think a lot of people find public health. I hear a lot of people say, I thought I wanted to be a doctor, but then I realized public health is actually really my passion area.
Yeah, the thing that I kind of love the story. So what really drove me to seek a master's in public health was so my undergrad degree is in neuroscience, and I worked in primate labs. And I worked on a project that was on the long-term effects of early childhood stress using primates as the model. And it was that work and thinking about the fact that for that knowledge and the science that we were doing to really translate into something real for people was 15, 20 years, right, from when I was working on something. And I wanted to be more at the front of we're doing things to make change so that are really important. I just felt like I wanted to be more in that moment where you see the change happening.
Yeah, that makes sense. So when you started your degree in public health, what was that dream job at the end?
So my second year in the program, I took community health assessment, and I was part of the team that did a community health assessment for county in Colorado. And it was like that experience that told me that someday I want to live in a smaller community. I want to work for the local public health department. And like someday I want to be a director of local public health. And and that opportunity presented itself during the pandemic to a smaller community to really get in the door kind of on the ground level in a department. And I mean, you have these dreams, but they don't come true.
But like you said, I mean, doors do open, and it's taking the right opportunity at the right time, right?
Yeah, I'm incredibly fortunate.
Yeah, and it's hard work. I mean, I can't imagine what you're dealing with day to day, and a lot of probably adaptability and working in a fast-paced environment. And I'm sure not everyone's a fan of what you're telling them.
I don't read comments on news articles.
Yeah. So it's a lot, but it's great, important work.
Yeah, I couldn't imagine doing anything else. I was working in a much less demanding role prior to this, and I really enjoyed what I was doing, and I really enjoyed my team. And I think back on, what if I hadn't taken this leap, and I would have been upset with myself. It's a really great experience, and it's hard.
Yeah. What would you say is the most challenging part of your job?
Feeling like there's always so many more things that you could be doing, and trying to focus on what's most important.
Yeah.
And has the biggest impact. And that can be a hard decision to make in the moment all the time.
Yeah, for sure. Wow. Yeah, because your decisions impact so many people. Yeah. What's the most rewarding?
When I talk with various community members, either at a business or part of our schools or something like that, and I'm talking with them through like an outbreak investigation, or I'm trying to give them guidance, and the really genuine gratitude that I hear from them for the work that I'm doing reminds me that this is really important work and people value it. And so many of our community partners are working equally as hard. And so just understanding that we all appreciate each other and being reminded of that tells me that it's okay. It's hard work, it's long days, and it's the absolute right thing to be doing.
Yeah, that's great. It's like you're just one big team.
Yeah, that's what public health is, right? You're not just the public health department. You're not just whatever organization you work for. There's always so many partners. And that's one of the things I really love about it.
Yeah, I agree. Lots of collaboration. How would you say the Colorado School of Public Health prepared you for this role?
I think the classes that were practice-based learning focused really helped me get hands-on experience with some of the things that I value most about the work that I do. So like I mentioned, working on that community health assessment was really incredible. There's no way I would be where I am if I didn't have that specific experience with my community health assessment project. Taking the evaluation course, and I did some independent study work, diving into evaluation more, and that's where my background more is in public health, is in evaluation, and that opened doors to what other organizations are doing around public health, and sort of helped me understand what was possible within the field of evaluation or public health more generally.
Nice. What advice would you give to someone that is thinking about pursuing a career in public health?
If you're still in like undergrad or something like that and thinking about it, seek out opportunities to have some hands-on experience in something related to public health, and public health is super broad. I think that it's having those experiences and being able to make those connections between work that you do or have done and what you're learning in class that like really brings it to life, and you start to see how, I mean, a lot of us say this, that like everything is public health, but you really start to see that. And I think I can't imagine having gone straight from undergrad into grad school. I think I would have missed something.
How many years did you take off in between?
3.
3 years, okay.
Yeah, just that opportunity to find out what you're passionate about, and how you might be able to bring what you're passionate about and your skill sets into public health, because public health is so broad.
Yeah. Great. Is there anything else we should know about your career path?
I've been really fortunate to work for some really great organizations along the way. And I guess I bring that up because you don't know how those different experiences are really going to get you to where you are. So when I was in school, I worked for the School of Public Health, doing some work, contracted like evaluation work with some community-based organizations. And I worked for the Colorado Cancer Screening Program, which was a very different thing than what I'm doing now. And then I worked for the Mental Health Center of Denver for about 2 years, and that's where I left. And it was very sad to leave there, but to come to Routt County, and those experiences shape and inform what I do every day. And it's how I'm able to relate to all of the various community partners that I work with. And you don't have to have that same path, but it's these variety of experiences and being able to tie those together and understand how that all relates together that gives you a really great perspective on your career, on what you want to do, and on how to do the work that you need to do.
Yeah, that's a really good point. And I talk a lot about transferable skills. Every job you have, you're gaining a skill that you're going to use at the next job.
Exactly. And you don't know exactly what that skill is when you take that job.
No. No, every experience you learn something new about your career.
I absolutely would not be able to do the type of data work I do now if I hadn't been a part of an incredible data team at Mental Health Center Denver, for example. Like straight up, that experience got me where I am. What
was the interview process like for your current job?
It was all remote. Mm-hmm. So I did just 2 Zoom interviews after I had applied. I can't remember if there was like a screen. No, I don't think there was a phone interview at all. It was just a first interview over Zoom with director and a commissioner and a medical director. That was the second one. First one was just the director. That was it. And I think part of that was because things were moving so quickly and we really needed to get someone on board. I don't think normally those interview processes go so quickly.
Yeah. What was it like onboarding virtually?
I don't even remember.
It's okay. It's happening for so many people right now, and I find it interesting to hear how it how different places do it.
I was in the office for a
Okay.
bit when I first started, because we have a new office and I was like helping to get things set up and like I needed to get my materials and like, so, and that was also when our case counts were much lower and it was more appropriate to be in person.
Yeah. Yeah. Wow. Well, thank you so much for sharing your experience and your career path. And thank you for all the hard work you're doing in public health and keeping our Colorado communities safe.
You're very welcome. I hope that my story is helpful for others.
Thank you.